Hey everyone, Dr. Dwivedi here, board certified cardiologist. I currently practice in New York City, and today we're going to talk about if an aspirin a day will keep your cardiologist away. Aspirin has been in a lot of news recently, especially since the United States Preventative Task Force came out with new guidelines regarding the use of a daily aspirin for prevention of heart attacks and strokes. So in today's video, we'll be talking about the science behind using aspirin and who may or may not benefit from it. Aspirin is one of the most commonly used drugs worldwide. It is derived from a compound called salicylic acid, and the use of salicylic acid dates back to more than 3,500 years ago when the Egyptians extracted it from willow bark to treat pain and fever. Aspirin was eventually developed in the late 1800s and today has many uses. At higher doses, it can be used to treat pain, fever, and as an anti-inflammatory. At lower doses, also known as baby aspirin, when taken on a daily basis, it can be used to prevent heart attacks and strokes. It is available in the United States at 81 milligrams, and in Asia and Europe, typically available at 75 milligrams. Now, before we get into the treatment, let's talk about what causes heart attacks and strokes. Now, all the organs in your body need blood to function optimally, and the plumbing system of your body that carries the blood to all your organs are known as the arteries. Now, similar to how the pipes in your house can get clogged, these arteries can get clogged too because of formation of blood clots. And the formation of these blood clots can then impair blood flow to your brain and your heart, causing strokes and heart attacks. Now, these clots don't just occur randomly, and the clotting system of your body is meant to be protective. For example, when we cut ourselves, the clotting system of our body gets activated, and the clotting cells known as platelets help to form a plug to halt the bleeding. The problem arises when the same clots develop in the arteries of our body, impairing the blood flow. Now, clots in our arteries are typically precipitated by the formation of plaque. Think of plaque like the rust that forms in the pipes of your house. The plaque in our body is typically made up of inflammatory cells, cholesterol deposits, and it can grow over time to cause narrowing in our arteries. Sometimes, though, this plaque can break off or rupture acutely, exposing the inner lining of our blood vessels. This in turn activates our clotting system, similar to when we cut ourselves, leading to formation of dangerous clots. Now, the way aspirin works is it prevents this clotting system by inhibiting our clotting cells known as the platelets. So as you can imagine, while this helps with prevention of heart attacks and strokes, it does increase your risk for bleeding. And this is why the decision to treat with aspirin is nuanced and should be individualized. So who really should be taking aspirin? Now, the answer lies in your medical history. If you have a history of heart attacks, strokes, or have needed stenting procedures in the past to open up blockages, then typically you should be taking a daily aspirin. Moreover, if you have low levels of plaque in your body, which can be diagnosed by your doctor by performing imaging tests, then typically you would benefit from a daily aspirin. If you fall into any of these categories, then the new guidelines don't really change anything you should be doing, and you should continue on your daily aspirin regimen. On the other hand, if you don't fall into any of these categories, then the decision-making process for you is more complex. In these cases, your doctor will typically assess your risk for heart disease. This is done by evaluating your age, your blood pressure, cholesterol numbers, and your diabetes status. And this is balanced against your risk for bleeding. For example, if you have a history of peptic ulcers or hemorrhoids. Now, if your risk for heart disease is high and bleeding risk is low, then you should talk to your doctor as you may benefit from aspirin. On the other hand, if your bleeding risk is high and your risk for heart disease is low, then the risk of using a daily aspirin typically outweighs the benefits. So to help with this decision-making process, the United States Preventative Task Force came out with new guidelines regarding its use. Now, they recommend that if you're between the age of 40 to 59 and your risk for heart disease is high, then you may benefit from a daily aspirin. They also recommend that if you're above the age of 60 and don't have heart disease, then starting a baby aspirin for the first time is likely not beneficial. This is because even though your risk for heart disease goes up with age, so does your risk for bleeding. So it's important to consult your doctor and talk to them about your daily aspirin regimen and before starting or stopping it. I really made this video to shed light on the complexities that are involved in the decision-making process for using aspirin. If you learned something today and liked this video, please feel free to hit the like button and subscribe to my channel. If there are other topics you'd like to learn about, please feel free to comment in the section below.